All right, and we are live. So if you are around, students, please check in, and we're going to rock and roll in just a minute or two. So tell me that you're here. Tell me that you're around. And Elena, can you see the comments?
I can. I see a private chat and then comments are listed on the right side.
Cool. I wasn't sure what you saw. So hopefully they'll start. There you go. Kaylin, Heather, Bethany, hello. And for everyone checking in, if I emailed you, awesome. There you go. Alex, Nicholas, Jennifer. Awesome. Thank you for checking in. Keep checking in. Let me know that you're here. Michael, hello. What's up? See, and then hello from Michael.
Oh, I do see that. That's cool.
Right. So Michael's got the classic YouTube profile shot. So Michael's one, he's interested in going into sports nutrition possibly and becoming a nutritionist. So I would like to touch on your undergraduate work in dietetics.
Okay.
So, I'll say one thing to the students before after class. If I have emailed you, if we're talking about next semester, checking in, please get back to me whenever you get a chance. But without further ado, let's begin. Today we are more than blessed to have Elena Rodriguez. She is a physical therapist from the Sports Medicine and Training Center, which was actually right down the street from here in Webster Groves.
Yeah.
They moved over into Crestwood off of Watson. So they're right around the corner from us. It's a great conversation today because I think we can get into physical therapy, what a clinic looks like when they combine physical therapy and fitness and kind of post-rehab fitness. But then also we want to hear about what exactly dance medicine is and how involved you are with that as well. So Elena, hello.
Hi.
It's great.
Good to be here.
Yes, absolutely. And so we were just talking about that. So going back to undergraduate, you were in Missouri State. Was that where was your undergraduate?
Springfield, Missouri. Yeah, Missouri State.
Okay, you were at Missouri State for undergraduate. Yes. Okay, all right. So dietetics. So why dietetics?
So basically, when you're 18, you got to figure out what you want to do. And physical therapy was always like the plan. Sure. I got into Missouri State, was Southwest Missouri State at the time. And I also got into SLU. What SLU does, if you go into the PT program, it's an automatic admission into their graduate program. So I believe your undergrad might be kinesiology or pre-physical therapy. Right.
Three undergraduate and 3 graduates.
Right. You go straight through. And Missouri State, the PT program, I graduated high school in 2003. So the PT program was just founded in 1999. And it was a acceptance in as a senior to graduate school. So it was a total of 4 years undergrad and then 3 years graduate school. And basically I got into both competitive dance teams.
Wow, nice.
Well, thank you. And Missouri State was the better dance team and they competed nationally. So I chose Missouri State. I'm not even going to lie. It was for the dance team and to be more active in dance. And there's some
athletes here that can attest to that.
Oh, for sure. Yeah.
Come play ball and everything else. Sure.
Right. So that was always I was going to be on dance team and physical therapy was going to happen. At the time, Missouri State didn't have a pre-physical therapy degree. So when I went to a kinesiology degree, I don't think for undergrad. So when I went to the majors fair, athletic training, it was a competitive program down there and it was already started, student ATCs were already with their sports. And so when I went to the majors fair, they said dietetics or nutrition or biomedical sciences. And I was like, nutrition sounds way more interesting, right?
Yeah, sure.
So I was going to actually get my RD after I had gone through the 4 years and as well as possibly apply to get my DPT. But then just looking at what my professors did, a lot of my RD professors worked multiple jobs and kind of had a side hustle. Not that that's a bad thing. I didn't want to delay PT school anymore and maybe get off rail with that. So I just went straight into PT without getting my RD, which at Missouri State, I would have needed to have a whole year of unpaid internship. And that's a lot when you got to pay off loans.
That's tough.
So So I chose nutrition and I really did love it. But if you look at social media and a lot of things on the news, everybody thinks they know the best diet, to be perfectly honest. And when you talk to people about diet, it's almost like politics. They get really offensive.
Yeah.
And that was even back then in 2007. Physical therapy and movement is a little more, people have a little more freedom and willingness to talk about that. And I don't know why, in my opinion.
Yeah.
So yeah, I went that route. I got dietetics and nutrition and then applied to PT school, only at Missouri State. And luckily I got in. So.
Cool. All right.
Yeah.
And has that helped you as far as being a physical therapist, having the nutrition background?
It does. I think though, to be honest, I think that's the thing with nutrition. You know, a nutritionist and a registered dietitian are different. They're different professions. They have different licensing. I think the nutrition helps, but for me personally, it's my participation in sports and dance that help me more with movement. You know, certainly I can speak to, you know, eat an anti-inflammatory diet to help with certain injuries.
Sure.
But I do leave that more towards the RDs, especially
Right.
now that I'm like 10 years removed from that education.
Sure.
So,
And do you have a nutritionist there at your training center?
we have previously in the past, but you know, we've gone through like a lot of evolutional changes, especially with COVID. So they would mostly be part-time, or we have people that we refer them to. That we
You've
work.
done weight loss programs and fitness programs and things like that, right?
Yeah, so we have, so there's a physical therapy side. We used to have an athletic training side, and we always have like a personal training side. All of our personal trainers have master's degrees in exercise science. And one particularly area of research was metabolism.
Okay.
So she has worked a lot with the weight loss programs and endurance athletes and stuff like that.
Okay. And so the transition from undergraduate to graduate was probably a little more straightforward being at the same school, right? As far as applications go, because our students are always kind of interested in, some of the students are kind of wrapping their head around what does application look like, or, you know.
For sure. Yeah. I think it was pretty straightforward. And again, like that was in 2007. I believe right now they like the APTA, which is American Physical Therapy's like professional organization. I think you do it a little differently. It's more globally. You apply online, and you can apply to different schools.
PTCAS.org. It's the website that everyone,
right.
You kind of do a universal application, a resume, and then you kind of send it out to all.
Right, which is probably maybe a little easier than printing it out and filling it out back then in 2007.
Going everywhere and writing a check everywhere.
Right. But it was fairly easy. Like I said, I only applied to one school. I told my parents I applied to 3, but thank God I got into that one. I'm not even gonna lie, guys.
Right.
But it worked out. So.
Right. Cool. And so did you have firsthand experience? So a lot of students and you know, as far as what we have exposure to career-wise in that, you know, we get hurt in high school sports or college sports. We work with an athletic trainer, physical therapist in your dance and on the dance teams. Did you have any injuries? Did you have any influence as far as that goes? And
I mean, yes. Yeah, that's pretty standard with most people that go into physical therapy. I had subluxing patellas, so that means my kneecaps dislocated a lot. Yeah. And I ended up having surgery then on each knee in high school. So that's how I became aware of the program and the occupation. And I did a lot of observation hours too in high school as well, since that was the plan.
Which is tough right now. The observation hours are so tough right now that we're having a hard time with. Let me go back just a second. So I have a few students in here that are also in kinesiology. They all will eventually take kinesiology. We just talked about differences between subluxations and dislocations. Yeah. So can you talk a little bit about your kneecap as far as what was happening there?
So if you look at a regular patella, you can kind of think of it like an iceberg. You know, on top we see visually it's very smooth. But on the bottom, it's more like an iceberg, and the pointy part is supposed to glide appropriately in that femoral groove as you extend your knee. Yeah. I think radiographically always, and again, this started when I was 8 and I'm 35 now.
Okay.
I think radiographically, my kneecap was always kind of like a contact lens, and it would pop in and out, and habitually, like maybe like 8 to 10 times out of a year. Not all of them were bad, but I think that eventually wore down my cartilage.
Interesting.
The first couple times it would stay dislocated. And when you say sublux, usually that means it goes like in and out.
Yeah.
And that's towards the end, that's what was happening more or less repetitively. And what I noticed with all the different physical therapists I saw until I had my knee surgeries was that they weren't necessarily asking about my sport and how I move. You know, dance is so atypical compared to like the football player or the baseball player, just traditional American sports. People don't necessarily think of dance in that way. And certainly some dancers are artists. I was not. I was more of a competitive dancer. So
Right.
we treated our team more as a sport.
But athletically, I remember way back when, 10 years ago, going to see Riverdance.
Oh, yeah.
And sitting there, and I'm thinking at the time, my knees were beat up, my ankles were beat up. I think I was wearing an ankle brace and a knee brace. And
For sure.
And we went and saw, my wife and I go and see Riverdance. And to see them dancing across the stage, I'm thinking, oh my gosh, they're like barefoot practically.
Right.
And it's just beautiful, but at the same time, as athletic as can be. I mean, I'm looking at their vertical and their athleticism and everything. So it's brutal. I mean, there's no reason it's, so.
Well, and the thought has changed. I mean, considerably against from when I was like 10 to now. We have a whole different understanding and appreciation of the athleticism, like you just said.
Right. So after the surgery, were you able to still dance after the surgery then?
Yeah. So I think my first one, I was probably a sophomore in high school. So basically what they do to fix a subluxing patella is they do a lot of your students take anatomy?
Yes, they're all mostly in anatomy right now. They just finished bones, skeleton. They're getting into muscles. So yeah, if you're in kinesiology.
Cool. So, so the patella attaches to the tibia with the patellar ligament, and where that a patellar ligament inserts into that tibial tuberosity, basically what they did was they shaved that bone off and they moved it medially. So if my kneecap was straight up and down with the kneecap and the quad and the patellar ligament, they moved it on the inside so that the pulled it more medially so it wouldn't sublux laterally. Okay. And obviously with the 2 screws and the bony healing, it took a couple weeks, maybe 8 to 10 weeks for everything to heal up. But yeah, I mean, I basically just told the physical therapist, do whatever you need to do. I need to dance by this date and we'll make it happen. But yeah, so I was able to compete with my high school team throughout all of high school, a couple weeks off. And then again, I danced for a year competitively in college. So,
okay. All right.
Yeah.
So getting into graduate school then, as far as PT school, coming from dietetics, did you have to take some other classes as far as what you were prepared for and what you're studying?
I did. You said
about anatomy and physiology. How does anatomy and physiology change from undergraduate, but then getting into a DPT program?
So at Missouri State, because it's like a bigger university, I guess, just more students and different science classes, we basically only had like 1 cadaver per maybe 30 kids. So I wasn't doing any of the actual like cutting. But for PT school, and I had a smaller class. So traditionally at Missouri State, I think they'll take around 30. We took 22, and then eventually we lost several to have only like 16, but there were 4 of us per cadaver. So 4 people working on dissections and verifying certain soft tissues and stuff like that. So that was incredibly different from when I was just like standing back and watching somebody else dissect. So
I remember that all the graduate students get to dissect and do everything.
For sure. I mean, it was very cool, but I mean, so it was in the mornings and we had lunch right afterwards, and poor college kids, at least I ate a lot of tuna fish salad. It ruined tuna fish salad for me because my hands would be covered in formaldehyde and I couldn't look at it and smell it on my hands. It was horrible.
I remember walking into the lab in graduate school. Now, we don't eat in our labs here at Webster University, so this I'm not doing. But I remember walking in graduate school, BYU cadaver lab, with a roast beef sandwich.
Oh, never again.
And I just walked in, eating it, not thinking too much. I was starving. It was lunchtime, and we opened up the lats, like the back.
Yes.
And the rectus spinae and the latissimus dorsi looked like it looked like, and it was dried out. It was an older cadaver, and it looked like my roast beef. It was just like night. And I was like, looked at it, and like, wow. So
yeah, same exact
roast beef
thing.
for maybe a week, but I'm back there.
But you're back to roast beef. Good for you.
It wasn't too hard to go back to, but
good for you.
So, so back to what you're doing today. So, day in the life of today. Are you, you know, have you had any patients this morning? Can you identify maybe the last two patients you had, as far as kind of what they came in with and what they're looking for? You've done with them?
Yeah, no, absolutely. So, my boss and I are the only physical therapists. We work with PTAs, so they're assistants. And what my boss and I do is, when we see a new patient, we diagnose them and then we do kind of like the plan of care. And then the PTAs, if we're busy, help administer that. So I've been here. So how we run this clinic is it's 6 a.m. to 7 p.m. Monday, Wednesday, Friday, so that we could get people in the morning and then people after work. And on Tuesday and Thursday, we have shorter days. Right now with COVID, my boss and I, because we do the same thing, we're trying to work on different days. So if something happened or there was an exposure, the other one could go to work after cleaning, assuming we got everything cleaned and we weren't all exposed. Right. But I've had like 8 patients this morning.
8 already this morning?
I started at 6. So
Okay.
I've had probably 8 people this morning, give or take. And like I said, the PTAs are still out there. So each of them has probably had at least 4 come in and out. I had a proximal IT band pain today of a 30-something-year-old male. He's a golfer and also does a lot of Peloton with the COVID pandemic, so kind of overuse of the IT band. Yeah. I've had a woman who is probably in her 50s with low back pain because she's been watching her grandkids more. Let's see. I mean, we've had a lot of kind of chronic. We're seeing a lot of chronic cervicalgia, neck pain from working at poor workstations over the COVID pandemic at home. You know, the elective surgeries, with that being stopped for a couple months, we haven't seen as much ACL tears or total knee replacements or other just general like surgery stuff, but we've seen a lot of chronic stuff that's just crept up from being sedentary over these past couple weeks. So yeah, I mean, and also, I mean, competitive sports are just getting back with our high school kids. So we haven't seen a lot of, like this time of year, we'd see a lot of football players coming in, or is this male soccer season for high school? We'd see a lot of overuse injuries with that. I have seen some cross country overuse injuries, some runner's knee and shin splints. But the competitive sports just people haven't gotten overuse or muscular imbalances yet for me to see them. Hopefully they don't, but we have seen a change.
And if sports do kick off, you know, hopefully they do in January, you know, there's gonna be this overload now, right? That everyone's gonna be out doing everything after sitting for so long. I even see that in our 4th grade boys and some of our kids that we coach, that they really sat around and did nothing for a while, you know, and some of these kids are really struggling, you know, my kids included. It was hard to get that level of activity, swimming and baseball and all the normal things that we typically do.
Oh, absolutely. Especially like in your home and in your basement where you're jumping on concrete, you know, which is also not great.
Right.
So
you did dietetics. If you could go back, you know, I'd say do a different major or maybe a minor. Is there anything that you would have minored in differently or different emphasis or something like that would have helped you more today, you think?
Yeah, that's a good question. I really think the RD thing would be cool to get the registered dietitian degree, but I don't know if it would help me too much in this realm. It would have been cool. I have always thought about getting a massage therapy license to do more aggressive work with that. But I don't know. I did undergrad and graduate school, I think, appropriately with the economic cost. I mean, college is so expensive.
Yeah.
And if I delayed it and got my RD, I would have been in a lot worse boat financially with loans than I was. So I'm happy with the way that it turned out. I'm happy Missouri State worked out. WashU WashU is an amazing school and their PT program is awesome. But I would have been in a considerable amount of debt if I chose that route. And for me, that wasn't important personally.
Sure.
So no, I don't think I'd change it. What I would change maybe is maybe do some abroad studying. I mean, I know Webster U has a lot of study abroad and getting out of the country and maybe experiencing physical therapy in other countries. I even had a student who went and did an internship in Italy and did some physical therapy there. That would have been awesome. I just never went that route. Yeah, I mean, she lived on a vineyard. That sounds amazing.
Yeah, sure.
Yeah.
And I have actually someone I think is here that asked me just about studying abroad, and we'll talk about that. Julie, if you're around, I know Taryn is asking about it. The other one is we do have an associate, a partner school. It's I can't think of the name of it right now, in London, that actually has some exercise science programs and equivalent classes. So we have students going to London, Athens, Greece. Cool. I would want to go there only because the birthplace of the Olympics, and
sure. So cool. Missouri State just didn't have that, which would have been cool if it did.
Students who are listening, freshmen, sophomores especially, if you want to talk about that right now and set that up, what does it look like if you're going to study abroad? Depending on when your sport is, but spring of junior year, fall of senior year. Junior year is kind of the most ideal year to do that. Mm-hmm. We can certainly set that up, and I can send you what that 4-year plan looks like, so we can talk about that for sure. So kind of along the same questions as far, because we talk about psychology or business. I don't know if you do any business, accounting, or keeping up with insurance law, things like that. Scott's your boss, right? Scott's still the...
Yes.
Right. So how do you, Scott, work together as far as the kind of the business side of things in the clinic?
Yeah. So we have a billing manager, and Scott's wife is also my boss, Roberta. They handle kind of more the business aspect of it. I created the Instagram account for marketing. I don't always post the posts for that. We have Kelly that does that. Traditionally, when I first started, we were going to different orthopedic offices and marketing ourselves that way. Insurance is a beautiful thing. It pays us pretty well, which is another nice thing, as opposed to like if you did personal training. For some reason, people are willing to take care of their bodies if insurance pays for it, which, don't get me wrong, that I don't agree with that. You should be taking care of your bodies 100%. But it makes it easy for physical therapists versus, again, a personal training side, which can be a hustle, especially during COVID.
It removes that barrier and kind of what people are thinking about investing in, and especially during uncertain times right now. There's so many uncertainties right now. It's a tough thing. Yeah.
Totally. But some commercial insurances only give you so many visits per calendar year. We do offer a private rate in regards to that. And we also too, if we've seen them in the past, we have programs where they can buy a card or a punch card and come here and work out, or come here and we can stretch them. We also do free injury screens. So if you have like a small pain in your shin because you've been running a little bit more, but you don't have a specific injury and don't know what to do with that, you can come in and we can do kind of like a evaluation for free. That doesn't always mean that we'll recommend physical therapy, but it gets people in the door. It gets them seeing our facility, meeting us, so that maybe in the future, if they do need physical therapy, this is who they pick.
Yeah.
So.
I got, as far as studying go, studying, just understanding all this knowledge and all these different skills and stuff.
For sure.
Was there anything that was tough? This is kind of that time of year. It's halfway through the semester. We just went through our first round of exams. Papers are coming out. So it's kind of like everyone's kind of getting an eye-opening experience about, wow, the anatomy is a little tougher than I thought. Kinesiology, I had to understand more terms than I thought.
Right.
Was there anything that you struggled with that you think, wow, I'm trying to be a physical therapist, but I don't understand muscles, right?
For sure.
As far as some of those two questions, kind of getting through those tougher times when you think, man, it's just tough to sit down and study and focus like this.
Right.
What was there anything that you struggled with personally, when it came to education?
For sure. Trying to think. At least with my undergrad, organic chemistry was horrible. It wasn't a requirement for physical therapy, but it was for.
Yeah, Gen Chem only. So yeah, Gen Chem 1 and 2. Yeah. We don't have organic chem. That was one of my.
Organic chem was miserable. I remember that. But no, once I got to graduate school, certainly physiology was a little complicated because it was your first year. Anatomy was okay. Research, I hated research. That was really challenging. And maybe if I went to WashU, a school with a little more research-based program, I would have struggled even harder with that. But for me personally, so I worked part-time while I was in physical therapy school, again, because, school's expensive. So I was a waitress. And when I scheduled my days, I was always able to schedule study blocks. Because if I didn't schedule that and I was scheduled for a shift, it wouldn't work out. So I'm just like a very type A scheduled type of person. And that seemed to work for me. Yeah. Just setting small goals and trying to hit those goals was what worked.
As far as your research goes, did you have to do a research project in undergraduate?
Yeah, I did not have to do one in undergrad, but in graduate school, yeah, you have to do one. I
just want to say this real quick. So for all students, and again, maybe one or two. I know Sky's here listening. She just said, hey, ready? But as far as all students, we do a senior thesis project here at Webster. So typically senior year, they do a semester called Research Methods. Okay. And then they set up, they ask a good question, they develop a good question project, and then they collect data and do the actual project in the second semester. So that's senior thesis, senior thesis research. But for all PT students, I know, because the feeling that Elena still has this, and she's years removed.
Yeah, I have PTSD.
Yeah, right. But it does set you up. We hope that it will set you up also for DPT, right? Sure. And then for research you have to do. So did you have a research project that you had to develop and do? Can you tell us a little bit about that?
Yeah. Ours was whether or not time of day affected a motor task. So our research advisor, I was partnered up with a classmate. She was more interested in the care of geriatrics, so older people. And I think her goal was to determine whether or not time of day affected a performance task so that you could schedule physical therapy at a good time of day for the person. With our program, basically what would happen is you'd be assigned to a professor, and typically they would have something already set up, and you would kind of be their free labor, which was nice, and you could pick which topic you liked the most. But we couldn't get I guess an IRB to get into the board to get us into a senior living facility. So we had to use, very tough. So we had to use all the people in our programs. And so basically all these people we tested on a motor task, which was using like a Wii remote to go up and down, but it was on your leg and you had to follow a ball and see whether or not their motor task was better at 6 a.m. versus noon versus 6 p.m.
Interesting.
Yeah. I mean, I think we just found out that procedural learning is a thing, especially with young people, and time of day didn't have a huge effect on them. But it was good to go through the process. It was just very painful.
Right. Yeah. It's a very autonomous project. I mentor a lot of these students, and there's other mentors here. And we all work hard, but it's a lot of independence and autonomy to the project.
For sure.
So Michael has a question.
Yeah.
When you were dancing, how often and how did you train physically outside of that, or was it dancing the training? And also compared to now, You asked about your diet as well. When you were dancing competitively versus how clean and awesome your diet is today.
For sure, for sure. So I probably didn't focus as much on my diet. So in high school, I was on the competitive dance team, and we would practice for 2 hours Monday through Friday. And then, so say 3:30 to 5:30. And then on top of that, you would do 13 hours at the studio of different styles. So competitive dance team in high school and in college, it was mostly like, have you guys seen those dance competitions on ESPN?
Sure.
Where they do it as a team? Okay. So
yeah, the entire team, kind of a cheerleading dance, kind of a combination.
Kind of. So yeah, that was more the style that my high school did. But then when we went to studio, we did ballet, modern, all sorts of stuff. So I mean, theoretically, I was dancing at least 20 hours a week. So I mean, and I was in high school, so I ate whatever I want when I wanted. It was pretty healthy because my family tends to be pretty healthy. In college, I didn't dance as much because there wasn't a studio that I was going to. But I did change my major to dietetics and nutrition. So I was very more focused on kind of like a 75 plant-based versus 25 meat-based diet, even though I didn't call it that at the time. You know, the term plant-based.
Developed into that.
Right. Plant-based diets are so trendy right now, which is what I'm doing right now, just to kind of be healthy and save the earth. But I wasn't as into the health aspect of it, nutrition then. Now, I will say once I stopped competitive dancing, I started lifting more traditionally, and I returned to dance. So those ESPN competitions, I worked for them for 2 years at being a dance teacher at dance camps, 2 summers in a row. And when I did change my diet and add weightlifting, I came back a lot better that sophomore year.
And are you able to talk to the young dancers about that? You know, if you could go back, would you take a little more time off maybe of dancing and focus on just strength? And
totally. It's interesting. I kind of fell into the dance medicine thing here. My bosses had a relationship with a Midwest Madco dance company, which is a modern dance company that used to be based out of the Two Hill. And I happened when I applied to tell them I like to dance, and one of my instructors was a member of the dance company. So we kind of created this dance program initiative where we worked a lot with the local companies. So I kind of fell into that, and now I do try to talk to a lot of dancers about cross conditioning and the importance of eating and. But it's a weird world. I don't know if you have any competitive dance is different from artistic dance, and they don't like each other as much. It's kind of like
I think the approach is a little different though, but I think a lot of athletes were guilty of that in some way. I know I've trained a lot of hockey players when I moved into Webster Groves, and I have a hockey player now. It's one of my who became a pro athlete. I started training him in 10th grade. Yeah. And he was sophomore, junior year in college. It was obvious he's going to go to the NHL. He plays for the Islanders now. He's doing well. But he told me if he could go back, you know, he did not want to take his skates off. He had to be on the ice all the time. He did not. You know, he'd come see me, but he'd come see me after 4 hours on the ice, and then he'd come train with me for 45 minutes to an hour in the weight room. And he came back maybe after he signed with the Islanders or his last year at Denver, and said, if I could go back, I would have taken much more time off. I would have just trained my body differently. I would have got my bare feet on the floor, out of my skates, and kind of felt that. But it's hard to tell someone in the moment, right? It's hard 100%. To tell a young dancer, you know, don't dance for 2 weeks and just work on mobility and push-ups. For sure.
Well, yeah, and there's a lot of like body image issues with dance. At least, I mean, it's getting so much better now, but they're so scared of bulking up, and really weight training doesn't do that. Usually, it makes your muscles long and lean and more powerful.
And done appropriately.
For sure. So, and overuse is a thing. So just like your hockey player was doing the same thing over and over again, training, you got to retrain your muscles. Your muscles are smart. They get used to certain movement patterns and then they degrade. You got to do different things.
Yeah. You mentioned, go back to your just about different skills you use, different things that you do.
Yeah.
When you do online, okay, so like we're streaming this right now on my Facebook page and on YouTube. As far as using Facebook, using Instagram, building community, marketing,
For sure.
Where do you see it being most beneficial? I think for a long time, it still is today. If you start a business, you got to have a website, you have a Facebook page, you got to have a YouTube channel, you have an Instagram account. But it's sometimes, I think, a little bit of a distraction, right?
Right.
That we're not just connecting with people and working with people. We're so busy with this. And I know I've been guilty of that myself.
For sure.
As far as where you see the benefit of that, everyone's comfortable with Snapchat and Instagram, and these students are especially. But as far as utilizing that professionally, being aware of your personal profile and what you're putting out personally, but also the benefits of, is it marketing? Is it connecting with people? Is it bringing people back in?
For sure. So we're utilizing, we have a Facebook account, we have an Instagram account. I don't think we're hip enough for a TikTok account. Yeah, that's okay. But so my boss has really utilized, we are a privately owned clinic without any franchise affiliation, without any affiliation with a hospital. And what I think we're going to hit hard soon, especially with COVID and this love for local restaurants and local places, we're going to try to market that as we're a mom and pop physical therapy place. And there's really none in the area. Right. A lot of our return people, it's through word of mouth. We have done virtual talks on Zoom, but for us, we're a really manual clinic where you're gonna see your best benefit is if you get in and you get that touch. And not all clinics are like that. So for us, it's kind of a word of mouth thing. We want to be a part of your healthcare community. Most of our referred patients are from people we've seen in the past.
I think for patients to understand that when they go see a doctor, and this for anyone listening, I know a few other people listen on Facebook, that a doctor will say, well, go here, just go to the local Athletico around the corner from you.
For sure.
You can pick someone out. I think as far as that advocacy for yourself and really that, and like you are in charge of your own personal health and your the doctors
100%.
But I think that paradigm of 20 years ago where it was whatever PT was whining and dining their orthopedic surgeon the best, got the business. Well, there's always an element of that, but I think it's that.
No, 100%. It's all word of mouth. And I mean, we had a great community in Webster. We only just moved because the facility here was bigger and it was closer to my boss's house. We're very much a community physical therapy clinic, and that's how we market it. So,
that's cool. Yeah. As far as balancing work and the rest of your life, you work about 40 hours a week?
Probably not. I probably work 45-ish to 50, but I only see patients for 36 hours. So if I'm backed up on paperwork, I can take that home and log in and do it. So even if I do honestly work the 45 hours, that extra 5 hours of paperwork and login time isn't really that hard when you're in your pajamas and with your Shih Tzu. You know what I mean? But yeah, we're off. Some clinics are open Saturday and Sunday. We are not. We're off Saturday and Sunday. We do work long days at this facility, but that means I typically have 2 days where I don't have to come in office during the week. And right now that's Monday and Thursday. So if I get it's very nice. So if I get my paperwork done like really early and I stay on top of it, then I do work closer to 40, but it ebbs and flows.
You're essentially doing Monday, Tuesday, Friday, 12-hour shifts then.
Yeah, today's 13. Yeah,
there's some shifts. Yeah.
Yeah, it can be a long shift, but it really makes up for. I mean, it's so nice having that day in the middle of the week off where I can get my oil changed when nobody else is doing that.
Oh yes, that's. Anytime you go to the grocery store at a quote unquote normal time, it's like, how do people do this? It's
for sure. For sure.
Any kind of shopping, anything like that. Time off, are you active? How do you stay active yourself? I know, do you still dance?
I do not as much. I did a little bit once I first started here. So in 2010, I took some adult classes at studios in the area. Adult classes seem a little more novice, and I wasn't necessarily novice. But no, I do a lot of yoga, I run, and I do a little bit of weightlifting too. So yeah, I mean, you got to be physical if you're a physical therapist. It goes with the name.
You got to practice what you preach, right?
You got to practice what you preach.
Which is important because a lot of us go into this because, I'm I'm sitting in a weight room right now at my job, but I still have a hard time finding time to actually walk into this weight room and train, right?
Well, for sure. I do all my weight training and stuff at home. I don't do it here as much. But the beauty of this job is I'm touching people, I'm lifting people's legs. I'm not sitting at a desk. I'm moving constantly for 12 to 13 hours. So
sure. I know it's become more popular in physical therapy as far as specializations go.
Yeah.
Going into, have you got any advanced certifications, licenses, anything like that?
So at this time, I do not. My boss got trained in ASTEM, which is like more aggressive manual therapy with certain silicone tools. I'm planning on possibly getting my orthopedic certification or outpatient sports certification. Basically, you study and then you take the specialty test, I think maybe at like a Sylvan Learning Center testing facility, kind of like you would a GRE. You could do it in different physical therapy fields, like orthopedics is one, sports medicine is one, cardiopulmonary is one, geriatrics is one. Where I'm at my facility, it wouldn't change anything. But you need continuing education credits every 2 years, and it would suffice some of those requirements if I got an advanced certification. But it wouldn't change what I'm doing here at all. And if it was at a bigger facility with more physical therapists, possibly it would. But for me here, it doesn't change anything.
Yeah, I was talking to a PhD, a friend of mine. She got her PhD when I was getting my master's degree in graduate school. And she's a chair of a program in Cincinnati. And she actually said we were both athletic trainers. She's still an ATC.
Yeah.
She actually alluded to the fact that she thinks almost athletic trainers, and I hate to say this, athletic trainers are watching, but that ATCs, that PTs getting certified in sports medicine or getting that advanced specialty, maybe in place of a lot of athletic trainers, depending on how teams are hiring out to PAs and PTs and things like that. So I think even if you're interested in sports medicine, athletic training, PT is still probably the better route, right? Because you can still mix those things in and get a job like that.
Yeah, possibly. And that's another thing. It's at my school, it was ATCs versus PTs too. I think we can all exist.
Sure.
But yeah, I gotcha.
And ATC, I always compare it's sort of a hybrid because that's what my master's degree was in. I was a certified ATC for a while. It's kind of a combination between an EMT and a physical therapist.
Right.
Like we knew kind of half PT, but then we did a lot of how do you address, a blood or dislocation laying on a football field, and that sort of thing. But then you can bring them back into the training room and rehab them. But you just kind of had to know the scope of, how far you work with them before you referred them to a PT or something like that. For
sure, 100%.
So as far as continuing education, I know a lot of these students are like in Gen Chem and anatomy and physiology and kinesiology, and it's kicking their butt. The difference between undergraduate and graduate school versus continuing education. You don't just graduate, have your license and go on, right? Now you're done, you have to look at a book again.
Right.
How often do you do continuing education?
So I think it's statewide mandated differently. But in Missouri, which is where my license is, every 2 years you need to have 30 credit hours. And that could be 30 credit hours in a class, 30 credit hours. It could be a hybrid, in class, online learning. You could get a certification, but it does have to meet 30 hours.
Okay.
And that's every 2 years. So we got our license updated at the beginning of this year, and then I got 2 years to get that. So because of COVID, I've gotten like 14 on online classes, just to fill in some extra time at work. So I'm halfway there. So I got all next year to do it if I want.
Right. Okay. As we wrap up, any tips, ideas for a student undergraduate? Can you go back to those days at all in your mind? And
yeah, absolutely. Don't be afraid. I know shadowing is probably hard right now, but try to get into clinics, watch people. The other thing I would do that I think helped me get into PT school was I reached out to the program and asked if I could talk with them, a professor in there, to get my face in front of them and get some questions about the program as I was researching different areas, so that then when they saw my application, they could put a face to the name. I think that probably helped me a lot.
I love that.
But yeah, don't be afraid to ask questions. And even if you go, well, actually, no, put your interests. So if you're into a certain sport, write something about that and kind of link it to why you want to do physical therapy. Because I also wrote a lot about dance and how that's really helped shape me. And looking back, none of my classmates were into dance. So find something different to really make you stand out, get your face in there with the people who are going to pick the applicants. I know it's hard with COVID, but any way you can to put your name in front of them before the application process is really beneficial.
That's perfect. 'Cause I think about that. This week already, I'll have 2 Zoom meetings with athletes who are looking at Webster University. So a basketball player Thursday, 4 p.m. And I think while the students on this chat are, listening, you sort of chose Webster University. You looked at 3 different schools and, said, I'd like to go to Webster. DPT programs and these programs are tough programs to get into. There's a lot of students applying. So it's a little different. Now they're choosing you a little bit and they don't know you. I think that's awesome advice Elena offers, because to do a meeting like this basketball player I'm talking to Thursday at 4 p.m., I've already talked to Coach Olofsson about her. I'll speak with her. I've talked to the admissions office. Then I'll meet with her and we'll talk for a half an hour. And so when anything comes up, or when I meet her, maybe next fall, I already know who she is, where she's from, what high school. We remember talking like this. And so I think that's great advice. If, I could help set you up with that. But just to get a hold of a kinesiology professor at a graduate program, in Minnesota, if you could set up a Zoom meeting for 20 minutes, ask a few questions, there's a good chance that professor is going to be sitting on the admissions committee, looking at your name somewhere. So that could help a lot. Because it is, I think maybe that's something to do right now versus observation hours and things that we don't have opportunity to do.
For sure.
Yep.
For sure.
So, awesome. Any other questions for Elena? I'm going to wait for a minute or two. Anybody? Henny's here. I think of Henny because he's listening. He's actually a PTA at Athletico up in Hazelwood.
Oh, very cool.
And our Florissant area, Limburger 270, which is great. And so Elena talked a lot about that, having a part-time job. I mean, waiting tables is great if you're looking to make quick money fast and good money. Although right now, again, COVID's screwing the restaurant industry.
Right. Yeah. Sorry, guys.
Right. That's even a tough one too. But to get the experience, I mean, Henny sees this. He's getting paid, but he also is observing, shadowing, and he's doing a lot of PTA work, and it's wonderful as far as the experience he's getting. So that's another thing to look into as soon as things open up.
Some offices too hire techs. We utilize techs to do laundry and clean tables, and with all the extra cleaning here with COVID. So you might look into that as well, because again, that's a double bonus, paid, and you get observation hours.
Right. And do they do both? So can they get paid and you can write down as observation hours?
I think some have. I personally, we've had.
If I sign off of them or you sign off on them, because I know Henny. I guess you're the only one right now in this class because a couple of them graduated, but that's what he was asking the other day, and I was hoping we could be able to do that, right?
I would think you can. I've worked here, like I said, 10 years, and we've had 3 techs go to PT school. So I'm almost positive that my boss signed off on using that. Right. I mean, if you're folding a towel and watching me treat somebody, I think that counts.
Absolutely.
So.
Right. All right, we'll wrap it up with that.
Awesome.
If there's any questions, and we can always shoot Elena an email
Totally.
if you have any other questions. And if all the craziness in the world, normalizes a little bit, I may reach out to you about doing some observation hours, or
totally.
See your place and see what you do. That'd be great.
Absolutely, yeah.
All right. So thank you so much. This is awesome.
No problem. Anytime. It was wonderful meeting all of you guys.
All right. Thanks,
all right.
Elena.
No problem. Bye.
See you. For everyone else, that was good. I want to hear more questions for the love of Pete. But I know you're all listening different ways. But because I'm going to ask more about this. I think that was a lot of good insight, and we'll talk more about that. Whether I'm officially your advisor or not, if you're working with Dr. Schroeder, Dr. Pruce, Dr. Kiskert, but shoot me an email too. I'll bring this up in careers class. We're talking to James Harris, the owner of Brentwood Barbell, next Wednesday, October 28th. I think that first week in November, unless I find someone to talk to for sure that week, I don't have anybody for that week. I think we're going to follow up with some of these ideas, see where everyone is, and lay out your plan a little bit. Any kind of graduate school, master's degree in exercise physiology, PT, OT, DC, going to Logan. You might be able to visit Logan right now because they're local, just to see what programs they have going on, see if you can observe a little bit. So we'll talk more about that. Otherwise, thank you so much for hanging out, and have a great week. I'll see you next Wednesday.